All right, let's get into our interview tonight. And more than 6,000 Kenyans die of tobacco-related diseases yearly, affecting more men than women. So to put that into perspective, 79 men and 37 women die per week, according to the Ministry of Health. An estimated 220,000 children and 2.7 million adults use tobacco each day in this country. Now, to combat this, Kenya was one of the first countries to ratify the legally binding WHO Framework Convention on Tobacco Control. That was back in 2004, and then also adopted the Kenya Tobacco Control Act in 2007. We're gearing up to observe World No Tobacco Day in a few days. And joining me in studio now to take stock of the progress 20 years after the Convention on Tobacco Control was adopted and what more needs to be done to ensure it is fully implemented is Dr. Adriana Blanco Marquizo, the head of the WHO FCTC Secretariat. Thank you so much for joining us this evening.
Thank you for having me.
You once said that the convention is as strong as its implementation at the country level. We're 20 years on since it was adopted. What can you say has been done right so far?
Well, it has been done a lot. Perhaps not as much as we would like, because as you say, still many people is paying with their lives that this has not been solved. But we have had an advance that we have not thought about 20 years ago. But still, as you say, there is a lot of to be done. Smoke-free environments, for example, is one of the areas where country has advanced in general. Health warnings and now plain packaging is another area that is has been advanced. But for example, areas like taxes, that is a very, very important area, is really not has been used as much as it should. Because while many countries has taxes, but they don't put it at the level that really will impact the consumption, still giving also revenues to the country.
What would you say is the biggest barrier to seeing a decrease in tobacco use?
The tobacco industry has been, and every year when the countries report to us on the main challenges, always the tobacco industry is even the first or the second, but it's always among the main reasons. And it's understandable. It's a big empire, economic empire, that they don't want to see the revenue decrease.
When you talk about the tobacco industry, we're seeing a lot of firms kind of gearing towards Africa because of the young population. It's a new battleground, if you will. So how do you begin to strategize in terms of combating what they're doing here? Well,
basically, we have the instrument, that is the convention itself, because the convention really gathers all the measures, the minimum, the basic measures that countries put, because that is the important thing. Article 2.1 of the treaty state that countries can go beyond. So what we say always is, this is the floor, not the ceiling. You need to implement this, but go on more. And there are some countries in the world that now they are thinking measures even beyond the ones that are in the convention.
Right, we've seen a strong push from some when it comes to, you talked about tax, some against some policies that would inhibit their business. But moving forward, what can governments do from a policy perspective?
Well, taxes is one of the main policies that can be done. And one thing that is important first is the intersectoriality of the contemplation of the problem of tobacco. This is not a problem only for the Ministry of Health. This is a problem for all the country and for all the ministries, because they all have different roles to play. You see, agriculture with the growers, finances with the taxes. So we need to put everybody together, because at the end is the population of the country who is going to have the benefits of the implementation of the treaty.
I just gave some worrying statistics a bit earlier on in the intro as to how many Kenyans die from tobacco-related diseases. You know, from a public health perspective, what more can be done to change the culture and behavior, if you will, of society?
Well, I think that as anything, we have two kinds of activity, or three kinds of activities that we can do. One, we can focus on the young population to try to teach them in the schools what needs to be done. That has not been very effective. Why? Because when the kids go out of the school, the reality outside is different. In the other part, we can have cessation for those who are still smoking and want to quit. But the main thing is in the middle, is shaping the environment in a way that really discourages smoking. And that's why when you cannot smoke smoke in every place. When the prices are high, when you don't have promotion, sponsorship, or marketing in general of tobacco, with these things is when you begin to have the understanding of the population that this is not something that is expected to do, because that is why the government tried to put some regulations on it. And I think this understanding is in everything in public health. Is important that the environment make the healthier choice the easiest choice.
You talked about changing the habits of growers, if you will. We're seeing that happening here in Kenya. One of the counties is Migori, where they've gotten some tobacco farmers to find some alternative farming methods. How else can we scale and find other alternatives for them?
Well, I'm really looking forward to go to Migori, and I will have the possibility of going for the celebration of the World No Tobacco Day. Really, this is one of the articles of the convention, Article 17, that talk about this, because we need to think, even though it's not an urgency that the tobacco cultivation will drop tomorrow, because it's still, but we need to begin to think of these people who really have the earnings from tobacco cultivation to have another opportunity. And more than anything, because the condition of life of these people is not good. Many times kids need to be used in the work in the farms. There is the sickness of the tobacco, the green tobacco leaf sickness, that is the intoxication for the manipulation of the leaves, intoxication with pesticide, because they require a lot. So it's important that countries begin to see how you can help, and perhaps help this at the same time that you're helping the farmers, you are also helping the country, perhaps growing food that is so needed. So many countries, specifically in this region, has problem with food. That could be a sustainable way of having a win-win situation. A solution for this farmer that will produce something that is less risky and more profitable and better for the environment. And also you can have a chain, for example, of supply or procurement to provide food for the sector of the population that are more in need, for example.
I want to end this conversation on a personal note. You are a doctor, so beyond holding the mantle that you do at the FCTC, why do you feel passionate about this platform and this campaign?
I feel passionate because this is one of the few things that in health that has a solution. Many things you can do anything about it. Well, in the genetics is that you're going to get some diseases, but the majority, not all of them, but many of the diseases can be preventable when they are related to tobacco. Before the tobacco growing epidemic, let's say, cancer of the lung was a rarity, was not real. In women was almost unknown. And now we have as much women having lung cancer as we have men when they smoke in the same. So what passions me is something that I can see the results. I can do something for the people.
Thank you so much, Dr. Adriana. Appreciate your time, and hopefully this continues with the conversations we'll be having later on this week for World No Tobacco Day.